Introduction: Malignant pleural mesothelioma, MPM, is a rare and aggressive cancer that affects the thin tissue lining of the lungs, known as the pleura. It is primarily caused by exposure to asbestos fibers and often presents significant challenges in diagnosis and treatment. This article aims to shed light on malignant pleural mesothelioma, its causes, symptoms, diagnostic methods, and available treatment options. Understanding malignant pleural mesothelioma. Malignant pleural mesothelioma originates in the pleura, the protective membrane surrounding the lungs. Exposure to asbestos fibers, either through occupational exposure or secondary exposure, is the primary risk factor for developing this disease. Once inhaled or ingested, asbestos fibers can lodge themselves in the pleura, leading to chronic inflammation and the eventual development of cancerous cells. Symptoms and diagnosis. The symptoms of malignant pleural mesothelioma often manifest years or even decades after asbestos exposure. Common symptoms include persistent cough, shortness of breath, chest pain, fatigue, weight loss, and the presence of fluid accumulation in the chest cavity, pleural effusion. Due to its nonspecific symptoms, MPM is often misdiagnosed initially. However, medical professionals utilize various diagnostic methods, including imaging techniques like X-rays, CT scans, and MRIs, as well as tissue biopsies and fluid analysis, to confirm the presence of MPM. Palliative care and support. Malignant pleural mesothelioma is often diagnosed at advanced stages, limiting treatment options and the chances of a cure. In such cases, palliative care plays a crucial role in managing symptoms, providing pain relief, and improving the patient's quality of life. Palliative care specialists work alongside the medical team to address physical, emotional, and psychological needs throughout the treatment journey. Conclusion: Malignant pleural mesothelioma poses significant challenges due to its aggressive nature and late-stage diagnosis. However, advancements in medical research and treatment options offer hope to patients and treatment options. The treatment of malignant pleural mesothelioma depends on several factors, including the stage of the disease, overall health of the patient, and individual preferences. Treatment approaches may include surgery, chemotherapy, radiation therapy, and emerging therapies like immunotherapy and targeted therapy. The goal of treatment is to control the disease, alleviate symptoms, and improve the patient's quality of life. Surgical options for MPM include pleurectomy/decortication, P/D, and extrapleural pneumonectomy, EPP. P/D involves removing the affected pleura, while EPP involves removing the pleura, lung, and nearby tissues. The choice of surgery depends on the extent of the disease and the patient's overall health. Chemotherapy drugs, such as pemetrexed and cisplatin, are commonly used to treat MPM. They are administered intravenously to destroy cancer cells throughout the body. Recent advancements in chemotherapy regimens have shown improved response rates and extended survival for MPM patients. Radiation therapy utilizes high-energy beams to target and kill cancer cells. It can be used before surgery to shrink tumors, after surgery to kill remaining cancer cells, or as palliative care to alleviate pain and symptoms. Immunotherapy and targeted therapy. Immunotherapy drugs, like pembrolizumab and nivolumab, have shown promising results in clinical trials for MPM patients. These medications help the immune system recognize and attack cancer cells. Targeted therapies focus on specific genetic mutations found in MPM tumors, disrupting the growth and spread of cancer cells.